Hello, and welcome to your favorite program, the Health Center with Ozion at Kunie. Today, we're bringing you the topic, heartburn. Yeah. Though we have treated heartburn before, but because of popular request, I want to refresh heartburn again to some people. But remember, whatever you hear here as medication should not be used as a prescription. We do not prescribe medication. And we urge you to please always meet your doctor, because it is not our right to make prescriptions here, and we do not have to do that because we have different individual conditions, we have different individual histories. They cannot, no two persons have the same history. Medications and treatment is based on patient-centered care, and we cannot just give you medication or say request or suggest you take one unless you go to your doctor. That's where it is appropriate. From here, no. I remain your host, Akobi Dedike Ozion the specialist, your regular host. Now listen as we go ahead to discuss heartburn. So what is heartburn? Heartburn is just a discomfort that happens in the chest area, causing you pains and other symptoms, nausea, burping, and several other symptoms as you see here. And most times people think that it is their chest or their heart that is this problem, just like it is called heartburn. No, it's not exactly the heart that is burning. It is the heart area that is burning, but what could cause this to be burning? That is the question. So the problem of the heartburn is actually caused by acid. Yes, acid from your stomach. We have the stomach is an acidic place, has like pH of 1.5 to 3.5, and that pH level helps you the digestion as well as the retention of this food that is there. But at some point, this acidity could be increased, and there are factors that does it. Heartburn. So if this acidity of the stomach is increased, it becomes a problem. So that's like this is the stomach, there's a muscle here, and this is the esophagus or the food pipe. So the acidity of this place should be 1.5 to 3.5. At some point it is reduced to 0 to 1. So at this stage it's very, very, very bad. But someone to have this heartburn, which happens in this area because this is where your heart is. For someone to have this heartburn, maybe the person has eaten so much food and stuff this stomach such that the food here or the gas here could come across this particular muscle called the sphincter muscle and come up to this place, thereby causing a kind of sour taste to the person here that he feels there. So this region feels irritated. So it means that this muscle has a role to play for this to happen. So if this muscle is weakened and dilated, you're having a bigger problem of having heartburn. Then, what other thing? Could be that you're a smoker, which also affects this particular muscles and the capillaries, the nerves of that area. If it weakens, then you are prone to having heartburn. What else could cause this? There are certain factors like abdominal obesity. Abdominal obesity, sure, the one that has to do with your abdomen increase here. In fact, we discussed before, 45 inches, 40 inches for men, and 35 inches for women are in danger of what we call metabolic syndrome. So this is your belly button. If you measure here, that is where you are tending towards that. What else can cause that? What we call increased abdominal pressure. If you've eaten and you're bending like this, that's increasing your abdominal pressure and intra-abdominal pressure. There are other factors. Other factors could be that you're pregnant. It could pretend you to having heartburn. Maybe you're equally eating foods that are very spicy and acidic. Or some people have had experience with beans. Why? Because of certain elements in beans that makes them and their body. So it means and makes it this acidic in your body, increasing the acidity of the stomach. What do you do in this kind of situation, and how do you bear with it? We'll discuss that. So with this, the person feels a lot of symptoms, which like you can see on the screen. So what actually causes the acidity of the stomach to increase? Like when we discussed ulcer, we discussed about how the perforations in the stomach that could be caused by any kinds of irritations called gastritis. The irritations called gastritis. In the gastritis is the irritations in the stomach in the absence of a bacteria. But when a bacteria like H. pylori, the smart bacteria, the smart and wicked bacteria that causes stomach ulcer, then it is no more gastritis, it becomes stomach ulcer, which is the ulceration in the stomach that happens when those bacteria have hidden inside the crevices that they bore inside the parietal cell, causing the proton pump to be leaking, and that it increases here. Okay, so when this happens, the acidity of this place rises, and this, remember that particular bacteria survives in alkaline environment, and when it is hiding in these crevices, it produces urease, which is an enzyme that neutralizes the acidity, and that environment where it is hiding becomes alkaline. While your stomach is acidic, and that it is acidic, it irritates the already bore crevices in your stomach or perforations, and you are the one that bears the problem. This is ulcer, and this ulcer could equally allow the acid here to be allowed through the leakage in this particular sphincter muscle to go up here and be irritating your muscles of the esophageal pathway, the food pipe. When this irritation keeps increasing, it begins to weaken you and cause a lot of severe symptoms. And when it is not treated, you now might begin to suffer what you call GERD, gastroesophageal reflux disease, which is worse, because at this level, when this comes up like this, it's called acid reflux. No problem, you only feel it. But when it is irritating, it is heartburn. But when it extends forward, that is this. When this extends forward, it could begin to cause you strictures, cause you esophagitis, cause you esophageal metaplasia, cause you Barrett esophagus, which could lead you to cancer. These are complications I have just mentioned. What do you do if it is beans or certain kind of food that are very acidic? You try to eat alkaline food to neutralize it. The question is, what alkaline? Avocado can be used to eat beans. Banana, they are neutralizers. Take that. What else can you do? If you're eating and stuffing your stomach, reduce it. If you are eating late at night, avoid it. Ensure you eat 3 hours before you sleep. How do you lay on the bed when you want to sleep, or when you have eaten and stuffed your stomach? Ensure that you lie leftwards, so that the muscle of that stomach will have a place to lay on the stomach instead of the other way around, because of the way it's shaped. But must you sleep at that time? No. You can stay on a chair and sit upwards, and then try to reduce the stress this would cause you before you sleep. What else can you do? Ensure you do exercise. If you are already obese, which can put you in danger of having this, ensure monitor the kind of food you eat. Irritant food like tomato sauce, and the rest of them should be avoided. Watch your screen. Are they all? So with this and the complications, what do you do to avoid it going further? Has been stated, because if not, it might lead you to surgery and other comorbidities, even hypertension, even diabetes, microvascular diseases, and even to the extent of your eyes. A lot of things, because this has to do, here you have a lot of nerves that this can affect, and then it will begin to affect your heart and the rest of the organs in your body. It might be seen as a very trivial disease, but it can be very serious if it is not well managed. So let's know this, and let's help someone else by sharing this video and by educating others. Remember, I'm still your host, Osion the Expressionist, and here is Kunye. Here is the Health Center with Osion, and remember, health is wealth. The rest of the details to be seen on our page. Please join us, subscribe with our YouTube channel, and as well as on Facebook with Kunye. Thank you for being with us today, and always remember, health is wealth, and we don't prescribe medications. I love you all.